Hello everyone and welcome to this first educational video for the E-Brain Cranio. I am Marije van Dalen and I'm a PhD student and psychologist at the Erasmus MC Sophia Children's Hospital in the Netherlands. And during this first video I will be talking to you about appearance-related distress, what it is and how you can recognize it in children, adolescents and in adults with a visible difference. So let's get started. Appearance-related distress is something that is commonly seen in people with a visible difference. Now, what a visible difference is sort of hard to explain. There is no real definition, but there can be many causes of a visible difference. You can think of congenital conditions, such as a cleft lip and palate or craniosynostosis, but you can also think of skin conditions or traumatic injuries such as burns. So there's actually a lot of reasons why someone can have a visible difference. And there might be a lot more people with a visible difference out there than you think. Our most recent numbers indicate that about 1 in 44 people have a visible difference in their face, and 1 in 111 people have a visible difference either to their face or somewhere on their body. People with a visible difference can commonly encounter some difficult social situations. Maybe you recognize it yourself, people might stare at you, make unwanted comments, and sometimes teasing and bullying can also occur. Because of this, we think that people with a visible difference might be at risk for some adverse psychosocial outcomes. Before I discuss with you what appearance-related distress is, I would like you to think about the question: how many % of people with a visible difference do you think experience psychological complaints? Well, the correct answer is actually 33%. Which means that about 2/3 of people adjust well and don't have any significant psychological complaints. But on the other hand, that also means that there's still 1/3 of people that do experience psychosocial complaints. So that's actually still quite a big group that does not adjust very well. Okay, now we move on to what appearance-related distress is. Appearance-related distress is actually an umbrella term for many types of different things. So there are different ways in which the appearance-related distress can manifest itself. It can be through anxiety or through depression or through other psychological complaints. But what we mostly see is social anxiety. Now, social anxiety consists of two different things. On the one hand, there's a fear of negative evaluation, so people are very afraid that others might judge them. And as a consequence, they will probably try to avoid situations in which they feel they might be judged. So they probably will not speak up in a meeting or in class, or they will be very afraid when they have to give a presentation at school or at work, because they feel other people would probably form a negative judgment of them. They are probably afraid that other people will think that they might be weird or that other people will not like them for who they are. A second aspect of social anxiety is social avoidance and distress. This means that a person will try everything in his power to avoid social situations. And when it's not possible to avoid these situations, a person might feel very anxious and very tense. So for instance, this person might start to sweat, might start to breathe very fast, or he might start to shake. And of course, these reactions are very distressing and could induce even more anxiety. On the other hand, when it is possible to avoid a social situation, the person will probably try to avoid these. So the person might try to avoid going to gatherings such as birthday parties, school parties, or they might avoid meeting with others. And of course, as a consequence, these people might start to develop some social isolation. So you can imagine that it starts off very small. You cancel some meetings because you don't feel very well or you don't feel very confident going to these meetings. You know, at first glance, staying at home is very comfortable. You don't have to worry about what other people think of you. You can just stay home, relax, and do what you like. However, this might grow into something bigger. So after canceling the first meeting, you might think, okay, maybe I cancel this other meeting too, you know, and I don't feel very confident in going to this other meeting. And before you know it, you can be very isolated. So, and eventually, if you're socially isolated, you might feel very lonely and you might feel even more anxious about going out because you know that when you go out, you feel very anxious. Okay, so now I told you what appearance-related distress is, and now we move on to what risk factors are there for experiencing appearance-related distress. But first, I would like you to think about the following statement. The more severe someone's visible differences, the more psychological complaints or appearance-related distress this person will experience. Do you think that this statement is true, or do you think that this statement is false? Well, actually, contrary to what you might expect, this statement is false. There's many studies out there that have shown that it doesn't really matter how visible the visible difference is. So someone with a very visible difference might not experience a lot of psychological complaints, while someone with a less visible difference might experience more appearance-related distress. So if the severity of the condition does not experience appearance-related distress, then what does? Well, there's actually several factors that have been investigated and have been shown to be a risk factor for experiencing appearance-related distress. The first one is a subjective experience. So if you were to ask a person with a visible difference, how visible do you think that your condition is? If a person answers on a scale of 1 to 10 and he says, well, I think 10, it's very likely that this person will also experience some appearance-related distress. While the person scoring 1, is very likely that he will not experience a lot of psychological complaints. And this is also true for similar medical conditions and similar visibility of these conditions. And a second factor is being female. We know from many studies that females experience more appearance-related distress than males. And this might also be consistent with what we see in the general population, where women are also more prone to experiencing anxiety and depression than men. A third risk factor is being teased or bullied. We know that people who have experienced teasing or bullying are at risk for developing further psychological complaints. And the same is actually true for people with a visible difference. So someone with a visible difference that was teased or bullied in the past, it's just a risk factor for experiencing appearance-related distress at a later age. Okay, now let's talk about how we can recognize appearance-related distress in children. As we know, in childhood there are many developmental tasks present. One of these developmental tasks is forming a sense of identity. And of course, appearance is also a very important concept in childhood. Children will understand that they're either a boy or a girl and how they look, and that how they look might also influence others. And because of these developmental tasks, we usually don't see any appearance-related distress before the age of 8, simply because children might not be very aware of their appearance and others' reactions on their appearance. But after 8, sometimes we can see some appearance-related distress. Now, there are things that we commonly see that can indicate some appearance-related distress. And one of these is being afraid of being teased or bullied by others. The children might be afraid that other people will comment negatively on their appearance. And because of this, children might prefer to play alone, and they might prefer not to interact with peers simply because they might be afraid that these peers will ask some unwanted questions or make comments that they don't know what to do with. And another thing that we sometimes see is that these children are very reluctant to participate in class. They prefer to sit in the back and they don't want to raise their hands because they don't want to draw any attention on themselves. And of course, there are many other symptoms of appearance-related distress, but I hope this list gives you some guidance on what symptoms we commonly see that might indicate appearance-related distress in children. Okay, and now we move on to adolescence. In adolescence, forming an identity is even more important. Adolescents are starting to interact more with their peers, they're forming some kind of peer group, and they are really getting a sense of who do I want to be in this life, what are my values, and what do I stand for. And you might also see that parents become less and less important, and that it's very important to belong to one peer group and to get positive feedback from your peers. For instance, you can see that in social media behavior, adolescents are very keen on uploading something on social media and then getting positive feedback from peers in the forms of likes or comments. Adolescents with a visible difference and experiencing appearance-related distress will maybe be ashamed or upset by their appearance. They might refuse to talk about their appearance, especially with parents, and they prefer hiding it from others. And they can sometimes act as if the visible difference is not there or is not part of their body. Adolescents may also refuse to have their photo taken. They don't want to be in photos, and if they really have to be in a group photo, they prefer to be in the back so they don't attract any attention to themselves. Because of their appearance, some adolescents might choose to isolate themselves. They don't go to birthday parties, they don't go to meetings with friend groups, and as a consequence, social isolation might develop. And because of this isolation, the adolescent might become very unhappy and have an irritable or low mood. Another symptom of appearance-related distress in adolescence is that the adolescent might be afraid that other people will dislike them. They might be afraid that other people think they are strange, or that other people might not like them because they have a visible difference. And the last symptom of appearance-related distress in adolescents is that they might be afraid of finding a partner. They might experience thoughts like, oh, I will probably never find someone who loves me because of the way I look. And of course, this might eventually prove untrue, but they might be very sad because of these thoughts. The symptoms of appearance-related distress in adults are actually very similar to the symptoms of appearance-related distress in adolescents. So they might refuse to have their photo taken, they prefer to hide their visible difference from others, and if they have a partner, they will probably also try to hide their visible difference from their partner. And as an adolescent, they might be hesitant to meet with others, and because they refuse to meet with others, social isolation might again develop. And we know from other studies that social isolation is a risk factor for experiencing anxiety or depression. If you experience anxiety and depression, you might start to isolate yourself even more. And as a consequence, some sort of vicious circle might develop. So you start to isolate yourself because you feel like other people might judge you, or you might feel very stressed in social situations. And because of this isolation, mental health problems might occur. And because of these mental health problems, you will start to isolate yourself even more. And so you can see how this vicious circle can sort of send you spiraling down. As an adolescent, a last symptom is being afraid of being disliked by others. Adults with a visible difference and appearance-related distress might feel hesitant to speak up in meetings at work. They might be hesitant to speak up for themselves with friends or with families or in other situations because they feel like other people might not like them anymore. Now, I hope I have given you some overview of what appearance-related distress is and how you can recognize it in children, adolescents, and adults with a visible difference. If you like this video, please subscribe to the ERN Cranio channel because there's many more videos to follow in the coming months. And I also want to tell you as a last note, if you or anyone you know experiences appearance-related distress, please know that you're not the only one out there and there is people that can help you overcome these problems. You can talk to your GP or your treating clinician and ask them to refer you to a psychologist or anyone that can help you with your visible difference. If you have any questions about this video, please visit the website for the ERN Cranio or contact me through email.